Hello friends, accidents and fractures are common in our daily life. It may be complicated due to diabetes. In diabetic patient, fracture usually shows delayed healing and infections. But friends, it is known that diabetic foot and other diabetic wounds usually take long time to heal. Ilizarov may help them to heal properly and early, but it also requires regular dressings and sterile environment. Beware from all these things and you can get aware of your infection and fracture. Friends, in any other situations in driving patients like sanitization, regular dressings requires. Lizard is not other from that. Lizard also requires frequent dressings and proper sanitization environment. If you don't take proper follow-ups and care, it may also need when a fracture turns into compound or infected fracture, traditional method like plate and nail usually fails. These bone fractures not unite properly. The repeated surgery may requires. In such difficult situations, the Ilizarov technique is highly effective. The Ilizarov frame stabilizes the bone from outside, and since the implant is not placed inside the bone and infection usually not take place. The frame works with the help of rings and wires by gradual tightening adjustment. It aligns the bone fragments, closes the gap and stimulates the bone healing process. It increases the vascularity also, which requires for bone healing or fractures. In diabetic patients, the Ilizarov method has many advantages.